Okay, this video is about a book review. I'm going to do a book review of the Alzheimer Turning Point by Jack de la Torre, the best book ever written on Alzheimer's disease, or really let's call it dementia. Best, because I almost don't even like the word Alzheimer's. It almost gives me a cringe. It's like saying the word AIDS. I'd rather say HIV. So, the Turning Point by Jack de la Torre. Okay, so I'm going to start out quick overview, and I have talked a lot about dementia lately, but this lecture will be a little different. I'm going to go into some papers I haven't discussed before. I'm also going to show lots of pictures. So for persons who want to see the pictures, here they are. Typical Westerner American eats a high-fat diet with a lot of processed foods, so they get coronary artery disease. This is the ascending thoracic aorta as it comes off the heart. So here's the proximal coronary artery, like the left main coronary artery. Okay, and they tend to get proximal atherosclerosis as well as diffuse atherosclerosis in the coronaries from a high-fat diet. They also very commonly early on get atherosclerosis in the carotid. Coronary artery disease is more common than carotid artery atherosclerosis, but it's right here. So this is the common carotid artery, bifurcates into external carotid, that goes up to the face. Internal carotid artery goes up to the brain. And this is right where they get the plaque. It's due to the trauma of hypertension bouncing off this median divider between the external and the internal carotid. Persons like from Asia, like Japan, China, that eat tons of salt, the white rice is good for them, but they have a tendency to eat way too much salt, especially like in Japan, for example, eating over 12 grams a day. That'll cause hypertension, and they get some intracranial atherosclerosis. They have a tendency towards that. That's even been called the Asian pattern of atherosclerosis, and this is the Western pattern of atherosclerosis. So high-fat diet down here, intracranial from especially super high sodium. Plus, they're also smoking like chimneys, and that also contributes to hypertension. You know, smoking tobacco is a strong vasoconstrictor. Okay, so one of the things that happens and that came out of de la Torre's work is that he noticed that when he's tying off the mouse's carotid, they would get atherosclerosis, they would get demented about 2 months later if the mice were middle-aged or older. But the younger mice, like let's say the equivalent of a mouse less than 20 years of age, it did not get demented. And the reason for that, he believed, is that as we get older, even if we do everything right, we do have some reduction in the amount of cerebral blood flow that we have. Esselstyn's talked about that before, that we produce decreased nitric oxide in our endothelial cells, the arterial lining cells, as we get older. I think some of that might be just due to the fact, it depends. I haven't seen the exact information in a paper, but what your population is. If you look at these, blue zoners, plant-based for life, they have the same blood pressure as a teenager as they do in their 70s. So you're not going to get as much a reduction, most likely, as you get older if you've been eating and living healthy all along. But just for the purpose of discussion, let's say about a 20% reduction in cerebral blood flow from the age of 20 to 60 years of age. And the relevance being that if you're already down 20% and now you go down another 20%, that's a big deal. Then you're 40% low compared to what you were at, in your teens. Okay, but if you were at your baseline, that initial 20% to drop, let's say, for whatever the reason, high-fat meal, is not as big a deal. But anyways, you get the point. Older person's more vulnerable because they're dealing with probably in the ballpark of a 20%, potentially more reduction in cerebral blood flow just due to aging. It's been described as going down about 0.5% for every year. So in 10 years, it'll drop another 5%. So that would imply that if you went 20 years, like an 80-year-old would have a 30% reduction, let's say, compared to when they were a 20-year-old in their blood flow. So that's why aging is, it's a big deal in terms of predisposing you towards vascular dementia. Okay, and of course we talked about this a couple times. This is the de la Torre theory of what he calls the Alzheimer's. Again, we shouldn't even call it Alzheimer's, just call it dementia. And the idea was he tied off the carotid artery. Sometimes he would tie off both. Sometimes he would tie off the vertebral artery as well. Sometimes he would tie off the intracranial arteries. But the basic study was tying off the carotid artery, and typically 2 months later, the mouse would be demented. He did an autopsy, went in and looked at the mouse brain, and there was no stroke. Okay? It wasn't a sudden, necrosis from a large vessel proximal, large vessel occlusion adjacent to the infarct site. It was apoptosis. Brain cells dying slowly from not being able to reach their metabolic demand. Okay, and the brain would just be shrunken on the same side where he did this tied off their carotid artery. So then we talked about the mouse equivalent things that also drop cardiac perfusion of the brain, atrial fibrillation, Your atria is not contracting normally, so you can't fill your left ventricle adequately. Mouse equivalent. Congestive heart failure, the heart's not pumping adequately. Mouse equivalent, okay? Aortic regurgitation, aortic valve, aortic stenosis, mouse equivalents. Hypotension during an operation, coronary artery bypass graft, a cabbage, or in the post-op phase, like I said, they run the pressure low, like my dad, to have them not bleed at the anastomoses where they plug in the artery for the graft. Okay, so anyways, this is the Jack Delatory theory. It's called the vascular theory of dementia, or the vascular theory, vascular hypothesis of Alzheimer's. And you need to know this. This is an essential thing to understand, because tons of stuff this is foundational to lots of stuff. Okay, so then the question is, well, what are we trying to protect? What we're trying to protect here is the hippocampus. So the hippocampus is this little spot here. Hippocampus, like in some other language, Greek or Latin, means seahorse. And they thought this was shaped like a seahorse. And so this area is the first to go when there is chronic cerebral hypoperfusion. It's very sensitive to a lack of blood flow, lack of oxygen. So, and this is your memory center. So, it can go pretty fast. So you want to protect it. And you protect it by watching lectures like this. And we'll talk about what to do. Obviously, it's going to be, more of the same stuff we talked about. One key point is they've tested the blood flow to the brain, all kinds of screening studies. And you can do PET studies and SPECT studies and whatnot. And there's special MRI types of studies you can do. Arterial problems from hypertension and diabetes, they happen first before the cognitive impairment. That's an important point, okay? The vascular problem comes first. And this has been called the Neurovascular Unit. So an artery is a bigger artery. Arterial is a little tiny artery, and then that will become even smaller and go into a capillary. And so around it, you'll have the endothelial cells. So endothelial cells, endo means inside. These are the inside lining cells of an artery, endothelial cells. That's the ones that make nitric oxide. They're the key for regulating cerebral blood flow. The other thing about endothelial cells is they normally just extract glucose whenever it's available from the artery. So they can be injured by hyperglycemia. They don't have glucose type 4 transporters to block out glucose when they don't want it. So hyperglycemia can injure them. That's going to come up again. That's partly why diabetes causes damage to the arteries in the brain, because these endothelial cells, they just pick up glucose based on whatever the level is in the blood. Okay, myocytes are little muscle cells around the arterioles. When you get down into the capillary, they'll be called pericytes. Astrocytes, astro means like star, cyte means cell. These are the supporting cells to help the neurons. And they have these what are called foot processes that wrap around the arterioles of the brain. So the point is, you got this complex, delicate structure that regulates, that couples blood flow to neurons. So it couples oxygen glucose delivery of blood flow to metabolic demand, energy needs of the neuron for oxygen and glucose, okay? And so this starts getting messed up by hypertension, by diabetes, by inflammation. And once this gets damaged, then the body's less able to precisely, tightly regulate the amount of oxygen delivered to the neurons. Okay, this is just another paper saying the same thing. Decreased blood flow occurs before cognitive decline, from aging and then from all these atherosclerosis risk factors. Okay, in the base of the skull, sort of like right beneath your brain, in the middle of the temporal lobes, just above the brainstem, you have what is called the Circle of Willis. That's the name of the anatomist who sort of figured out the anatomy here, Willis. So Circle of Willis. Here's the internal carotid artery. This is like a cross-sectional view. Internal carotid artery comes up, that's ICA, bifurcates into the MCA, middle cerebral artery, and ACA, anterior cerebral artery. Okay. The artery in the back is called, at the base of the brain, is called the basilar artery. All right, and then it gives off the P2s, the posterior cerebral arteries. Okay, the reason I'm just showing you this is you can have normal variants. Sometimes they'll have these persistent fetal arteries, the posterior communicators, and they will be big and robust, and they will be supplying most of the occipital lobes. All right. Normally, though, the occipital lobe blood supply comes off the basilar. The relevance being is if you've got hypoplasia of this artery, if these arteries are big and robust, then you don't develop the basilar and the vertebral arteries so well, and they'll just be congenitally narrow for the rest of your life. This narrow artery is more vulnerable to mural atherosclerosis. So all I'm saying is you don't know what anatomy you got. You might have this anatomy. Any one of us could have it. I see this, probably at least once a day. So that's why you always want to optimize things, because you don't know if you got unfavorable anatomy that increases your risk of having a stroke or a heart attack. There's similar types of arterial variants in the heart, okay? So yeah, the basilar artery runs right along the belly of the pons. This is the brainstem right here. Here's the cerebellum. Okay. Here's a MR angiogram of a patient with bilateral persistent fetal type PCOMs, posterior communicating arteries, which then are the blood supply into the posterior cerebral artery. So this patient, has a really hypoplastic, tiny, diminutive basilar artery, thus predisposing them to mural atherosclerosis, blocking off the arteries coming off the posterior wall into the pons and the cerebellum, the pontine perforators, so to speak, and the cerebellar arteries. And these little bright spots, this is a diffusion weighted image, DWI image, and this bright spots, hyperintense signal, DWI hyperintensity, are indicators of an acute infarct, acute stroke. So basically this patient occluded their basilar or one of their cerebellar arteries. It's bilateral, so probably, the posterior wall of their basilar artery at least. And they got pop, pop, all these little white spots. Pop, 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 pop. Now, usually you don't get that many strokes all at once. You usually only get one at a time, but it's not uncommon to get 2 or 3 at a time. But anyways, what I'm saying is none of us knows if we got bilateral persistent fetal PCOMs such that we're at increased risk for this sort of thing. So optimize your habits and you'll never have a problem your whole life. Most normal variants, they don't cause a problem if you live healthy. If they did, they wouldn't be normal, okay? And all right, so now here's a paper I'm showing you about intracranial atherosclerosis, contributing factor to Alzheimer's, paper by Rohr. The relevance being that at autopsy of these Alzheimer patients in comparison with control patients, control patient has to die of something, and most people in the Western society have intracranial and extracranial atherosclerosis. But anyways, here's what normal arteries look. Cow just means Circle of Willis, what we were just showing on that previous slide. So these arteries are relatively wide open, okay? This one's got a lot of atherosclerosis, but all the rest of them are relatively wide open. That one's got a lot of atherosclerotic narrowing of the lumen. The lumen's the center of the vessel where the blood flows. Okay, now here is heavy atherosclerosis. And you can see there's this big atherosclerotic plaque around the periphery, circumferential, and a relatively small luminal diameter. This should be really more about like this. And so according to this paper, there was significantly more atherosclerosis in the patients with Alzheimer's disease versus the non-Alzheimer, non-demented controls. But this picture is a little deceptive because this is just an example. They showed you one of the most normal arteries up here and one of the most abnormal arteries down here. It wasn't like all the non-Alzheimer's patients had beautiful arteries like this, nor all the Alzheimer's had really severe, lousy-looking arteries like this. So I think that's a little bit tricky, okay? It wasn't that big a difference as this one single image would imply, but it's still good for you to get the picture. You don't want to be eating meat, oils, and processed food and plugging up the arteries in your brain. It makes you stupid. It makes you die sooner. You don't want to do that. I routinely look at brain CTs and see these calcified arteries all the time in the brain. Large percentage of patients over 55 years of age have that, and even a significant number have that earlier in their life, okay? So here is Goldilocks, and what we're going to talk about with Goldilocks, and Goldilocks and the 3 bears, to get it just right. You want your blood pressure not too high, not too low, because where it's just right, you're healthy. Everything is good. And if you just eat natural diet, that's where it'll go on its own. Your body is able to take care of itself quite well. Okay, so here is where, go back a slide, previous. Here is what we got to talk about. This is sort of the money for understanding dilatory and for understanding a lot of brain disease. So here's your brain, and here is your internal carotid artery, comes up into the brain. It's going to bifurcate at this point, and here's the middle cerebral artery. The middle cerebral artery then gives off these perforating branches called the lenticulostriates. And this level right here is the basal ganglia level. We're below the body of the lateral ventricles. This is the third ventricle right here. So blood then travels upward through the lenticulostriates. The artery then exits along the convexity of the brain. And then as it wraps around the convexity, it gives off these penetrating arteries. And this area right here is called the deep white matter with the skull and the crossbones. At the level of the lateral ventricles, it's called corona radiata. Above that, it's called centrum semiovalli. But the point is, what you want to know is, skull and crossbones is where people get tons of silent strokes. Some patients will have 100 of them, okay, or more, and they're not doing so great, okay. They don't necessarily have a unilateral paralysis, hemiplegia, but they're often really not functioning so well and not moving so well and well on their way to being demented and falling down and having all kinds of problems. So, what's the point? If your blood pressure is too low, why do people have high blood pressure? So they can get adequate blood up to their brain. That's the hardest spot to get blood to, pumping against gravity. And if their blood is thick, from eating the high-fat diets, it makes the red blood cells stick together, high viscosity blood. It's like a milkshake instead of like water. Pressure has to go up to pump it. If they're eating lots of salt, for example, vasoconstricted through here, lots of caffeine, vasoconstricted, they have to pump at a higher pressure. And, lots of tobacco, all that stuff is vasoconstrictors, narrows the artery. You got to pump at a higher pressure to get blood up to the brain. And then the point I'm saying is if they overtreat their hypertension, drop it too low with pills, for example, then they will not be able to get as much blood as they should to this deep white matter area here. And look at these little silent strokes from lack of blood flow, okay? And what Delatorre is basically saying is a chronic lack of blood flow globally to the brain will first of all damage this area right here, the hippocampus, your memory center, because it's the most sensitive, okay? Overall, people get a lot of silent strokes in this area. The other thing, too, is some of this is just from the high blood pressure itself, not from the low pressure, it's from the high pressure, and let me explain. Your pressure getting up over 160, it's hitting, like I showed you that bifurcation before, pop, 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 and especially, too, as you get older, your ascending thoracic aorta, if you've been chronically hypertension, you've overstretched your elastic fibers, can't replace them after 20 years of age. And so the systolic pressure, that's the upper number, has to go up higher because you can no longer have elastic recall from the elastic fibers in the ascending thoracic aorta. It's really like a second heart to maintain diastolic flow. So you get, instead, compensatory elevation of systolic blood pressure. And that will hit these little arteries in here at the bifurcations and just damage them. And then they'll form scar tissue, fibrosis, and they'll also get muscular hypertrophy. And all of that stuff contributes to further worsening of arterial wall damage and decreased ability to deliver oxygen. Okay, so here's an example of like what a normal brain looks like and an abnormal brain. This is a normal looking brain here. These are the ventricles. They're normally pretty small in size. And there's really no abnormal signal in here. The corticospinal tracts can have a slight intermediate signal intensity, but there's no hyperintensity. You can get a little hyperintensity along the frontal horns. That's actually normal variation. But this is not normal. This is a big mess. This is actually a pretty typical patient. Well, it's a little worse than typical, but I see this all the time. This would be like, I'd say, a typical lousy-looking 70-year-old. The ventricles are a little bit too big. I would call that mild ventriculomegaly. And I would call this extensive juxtaventricular is when it touches a ventricle. Juxta means yoke, like yoked to an ox, connected to something. So this is juxtaventricular hyperintense signal. This is near the vents but not touching it. So this is periventricular signal. This hyperintensity over here is near the cortex, so I'd call that subcortical. So the way I would read this out on a brain MRI report would be extensive juxtaventricular, periventricular, and subcortical flare hyperintensity, most likely due to small vessel chronic atherosclerotic ischemic disease, okay? Which basically means, a combination of the vessels being injured by hypertension and by diabetes and possibly by inflammation. We'll explain that in a moment, as well as, the Jack Delatorre, chronic cerebral hypoperfusion. When hypoperfusion can be because pressure is too low from overtreated hypertension, it could also be hypoperfusion just because the arteries are so damaged they can't deliver oxygen that well. Okay, now here's a picture of arterial flow. You can see this is going into a capillary. Here's the direction of blood flow in the direction of the arrow from this side to this side. These are the red blood cells. They fold back on themselves a little bit here. I'll grab myself down in here. They fold back on themselves as the blood flows through the artery. And the reason is, let's say that this is the capillary. Let me see if I can put the whole end on, okay? So you've got a capillary here, and the red blood cell has to go through it. When it goes through it, the red blood cell is bigger than the capillary, so it has to fold back on itself. Let me see if I can give you a picture. It has to fold back on itself like this in order to fit through the capillary. These spindle-shaped cells in here, that's the nucleus of the cell. Those are the endothelial cells, and they're aligned along the long axis of the vessel. So anyways, these RBCs, as they go through the capillary, they give off oxygen. The blue circles are oxygen. These are the vascular smooth muscle around, let's say, the arterioles. There's not really that much muscle around the capillaries themselves, but it's sort of a composite image. And the point is, normally this oxygen exits through from the red blood cell off its hemoglobin and travels to the tissue, in this case a neuron, a brain cell, and it goes just fine. This brain cell gets all the oxygen it needs, it'll get all the glucose it needs, everything is great. Okay, but when you've got chronic diabetes or chronic hypertension, you'll get thickening of this wall. In diabetes in particular, thickening of the plasma membrane, endothelial basement membrane it's called. Okay, that's what I got yellow. So this yellow thing is thickened down here in comparison with up here. What that means is you're less able to deliver oxygen to the tissue. You can also get thickening of the muscular wall. You can get fibrotic scar tissue like from hypertension. So all of these things, either diabetes-related basement membrane thickening or hypertension-related thickening of a muscular layer and fibrosis around the outer surface of the arterial wall, those will decrease oxygen levels. See how I got a lot more blue circles up here and a lot fewer down here? With this progressively diseased artery, you're going to get less oxygen delivered to the tissue. In addition, with aging, the endothelial cells in here, they're less able to make nitric oxide, the vasodilator. So that also is going to decrease the amount of oxygen, because decreased arterial ability to dilate and deliver more blood flow. All of these things are working together to deliver less oxygen to the neuron. And if it gets too low, that neuron will die. Okay, a little bit more about what's going on with this vascular injury here. See if I can get myself to shrink here. All right, I'll just go off the picture. So, cooperation between neurovascular dysfunction and beta amyloid. Amyloid beta, they go AB. Sometimes I'll just call it BAP, beta amyloid protein, in Alzheimer's disease. Again, the vascular injury occurs before beta amyloid protein, BAP, plaques like senile plaques, extracellular, and neurofibrillary tangles, intracellular. So here's a normal neurovascular unit in the brain. You got the endothelial cells right here, and these little green things are tight junctions that don't let anything to get in between. And then you got the pericytes on the out surface of that, and you got astrocytes, which are really important. And all of this is related to regulating blood flow to this neuron. So here's your neurons, the main communication cells in the brain. And all of this has to be carefully regulated and titrated so that this neuron gets whatever it needs to meet its metabolic energy demands. Well, all kinds of things start going wrong when you have hypertension, for example. It's going to damage these arterial walls and cause some fibrosis, as we spoke about. When you got diabetes, you're going to get thickening of the capillary basement membrane on here. Chronic injury to these walls with the so-called hypertension pattern and chronic cerebral hypoperfusion leads to increased amount of this stuff here, cerebral amyloid angiopathy, or amyloid, and our beta amyloid protein being laid down in the arterial wall. I'll show you a slide of that in just a moment. Also, high-fat diets can increase blood-brain barrier permeability, and you can get breakdown of the tight junctions between the endothelial cells and the capillaries of the brain, and then you can start leaking inflammatory things into the brain. Inflammatory chemicals are escaping from the blood into the brain parenchyma. Normally, they should never go there. And so that'll cause inflammation of the brain parenchyma. And then the astrocytes in response will release these inflammatory cytokines. And you get this whole big mess of things going wrong. Other thing is, we talked about the endothelial cells. They don't have glucose type 4 transporters. What it means is they cannot control the amount of glucose that comes into the cell. So if you're a diabetic with poorly controlled blood glucose and you've got high blood glucose, hyperglycemia, it all gets into these endothelial cells and it overwhelms their mitochondria. It'll cause reversal of electron transport in the mitochondria and a big drop in energy production, as will excessive saturated fat in general, saturated fat in particular. So once you get mitochondrial dysfunction, you can severely injure these endothelial cells. And when they're injured, they'll sometimes have a distortion in their shape, and that can be manifested as a DAMPS. DAMPS is a fancy word. It means damage-associated molecular patterns, whereby when a cell is damaged, you get distortion of its outer plasma membrane proteins, and the immune system will now see that it's not normally shaped, and it'll cause an immune response, an immune or inflammatory reaction against it to clear it out of the way, so a new cell could be put into that location. But all this inflammation can be harmful to oxygen delivery to the brain. In addition, in the setting of chronic hypertension, diabetes, and inflammation, you can get upregulation, or what are called the RAGE, and this means receptor for AGEs, receptor for advanced glycation products, and that also is related to sending beta amyloid protein from the periphery into the brain. So when you upregulate something, you make more of it. So the point of all this is the chronic ischemia and hypertension that we talked about leads to increased advanced glycation end products related to diabetes, for example, getting into the brain parenchyma and damaging your tissues. It's all bad. And you'll simultaneously get less of this thing right here, LRP. All you have to know is that transports beta amyloid out of the brain to the periphery. And that will be decreasing its function. So the bottom line is all of this stuff is bad. This is all bad. Nothing good. All bad. And that's what happens from eating the wrong diet, the high fat, high sodium diets. This is just a picture showing that there are mechanisms of beta amyloid precipitating, forming bulky aggregates. Normally, there will be only one little yellow circle by itself, okay? But you get them, they start aggregating, sticking together, and then they can bump into the membrane of a neuron. And when they do so, they can have a mass effect that distorts the function of this NMDA receptor. NMDA receptors are the receptors for glutamate. We talked about that in a previous lecture. That's the main excitatory neurotransmitter, and it allows calcium into the brain cells. So the point I'm saying is, when you get accumulation of beta amyloid proteins and they're starting to polymerize, meaning stack together, stick together, and become big and bulky and go out of solution, become insoluble, precipitate, they can bump into the plasma membrane, and that bumps into your NMDA receptors and opens them up, and that'll cause increased calcium entry into your neuron, and that can damage the neuron, be an excitotoxin, overactivate it. The reason I went through all that was to show you these things can be all connected. That's how stuff is in the human body. A lot of stuff's connected. It sort of flows like a story. It's not just 1 + 1 = 2. It's more like this plus this plus this plus this plus this, push towards that. Okay, here's a neurovascular mechanism, blood-brain barrier problem in Alzheimer's. So this green stuff is staining for amyloid. And the point is I'm showing this beta amyloid protein can really accumulate in significant amounts all around the circumference of an arterial in the brain. Okay, and you'll have less ability to clear your beta amyloid, especially when it's all precipitated, and you got poor oxygen glucose delivery. And anyways, this addition of all this material to the arterial wall decreases the ability to deliver oxygen to the tissues. So we talked about the hypertension just by itself damaging the arterial wall, leading to thickening by fibrosis, scar tissue laying down collagen, and increasing smooth muscle thickness in your arterioles, for example. Diabetes itself damaging the arterial wall, glycating it, thickening the endothelial basement membrane, etc. There's another type of inflammation that also damages arterial walls in the brain, and that's due to leaky gut and inflammation. This was especially the work of Douglas Kell and Etheresia Pretorius. Douglas Kell's the PhD guy from England. She's from South Africa. Okay, so we're not going to go into that much right now. I gave a whole entire separate lecture on it, but the reason why I'm even bringing it up at all at this point is because I did see some new papers that support the theory of Douglas Kell and Etheresia Pretorius. They're rather interesting. And when you get, beta amyloid accumulating in the arterial wall, you're less able to deliver oxygen and glucose to tissues. And we talked about how a moment ago on that previous slide, when they oligomerize, polymerize, all stick together, a bunch of them, the beta amyloid proteins, they can bump into the NMDA receptor, okay? And all of this stuff is bad. Chronic cerebral hypoperfusion injures these nerves. And so there's a whole bunch of things adding up to damage the blood-brain barrier and oxygen delivery to the neurons. And it reminded me of a quote from Hamlet, how all occasions doth inform against me. So all of these things are working together to damage blood flow here to the neurons and thus damage the neurons. Okay, this is just showing how you can get a vicious cycle of negative feedback, of feedback causing amplification of bad things. Lack of blood supply, vascular insufficiency leads to problems with producing increased beta amyloid from the neurons and increased difficulty clearing it out from the brain, increased blood-brain barrier permeability. There's beta amyloid from the periphery and from the central nervous system, increased transport of beta amyloid from the periphery to the center. So everything bad is happening, and then this accumulation of beta amyloid is damaging the neurovascular unit, blood-brain barrier, making it less able to deliver oxygen to tissue, so they keep on making each other worse. And that's why I said you want to break the cycle to the extent you can. For example, going low-fat, low-sodium vegan and sticking to it 100% to try to get your body, back in to proper balance, so to speak, like it should be. And again, that's why I say, we're made to live like Adam and Eve, but keep our indoor heating and plumbing. Genesis 1:29. Okay, chapter 1, verse 29. Okay, here's an example of the stuff from Douglas Kell. What was the work of Douglas Kell and Atherosclerosis pretorius? They talked about in the setting of leaky gut, you can get bacteria moving from the gut into the blood. And they can also send their toxins like LPS, lipopolysaccharide for gram-negative bacteria. There's also something called LTA, lipoteichoic acid for gram-positive bacteria, and that will get into the blood. LPS and LTA from bacteria, when they get into the blood, they predispose blood clots to form in the blood. And they actually cause a bad type of blood clot. Normally the fibrinogen should be in what's called an alpha helix configuration. That's kind of, I'll show you with my hand here. The alpha helix is sort of cylindrical, like if you cut the top and bottom off a can of soda pop, cylindrical. And that's the way it's supposed to be. When it changes to what's called the beta sheet configuration, so alpha helix configuration is kind of like a slinky, cylindrical. It'll change the beta pleated sheet, so then it can stack on itself, okay? This forms, hydrogen bonds intramolecular between different parts of itself. This forms hydrogen bonds between different individual separate fibrin molecules, okay? And so when you have beta pleated sheets in large amounts, that's called amyloidosis, and an amyloidogenic form of blood clotting that's much harder to dissolve. And in the work of Douglas Kell and Atherosclerosis pretorius, they suggest that this was associated with causing more precipitation of the beta amyloid proteins, meaning precipitation in that case, meaning polymerizing. Instead of having one beta amyloid protein by itself, it groups into several. That's an oligomer. And then it groups into a whole bunch of them. That's a big polymer of it. And then as it bigger it gets, the more big something gets, a molecule gets, the more likely it is to become insoluble. And when it precipitates out of solution, it's then harder to remove as well. Okay, so one of the reasons why I even brought that up at all is I saw this paper here that I thought was kind of interesting. And what they showed both in humans and in mice, that there was excessive amount of fibrogen in the brain, and it was colocalizing, meaning going to the same spot as the beta amyloid protein and where the neurons were damaged. So this is a paper of researchers independent of Kell and pretorius, and they're finding the same thing. Plus, I can tell you, I found it in a bunch of other papers. They're all saying the same thing. There's an increased tendency for fibrin, blood clot, atherosclerosis, and blood clot are kind of the same thing, to colocalize with where this beta amyloid protein is present and the neurons are destroyed. And this fits with the whole leaky gut, dormant bacteria reactivation of bacteria by iron overload with increased aging as well. So that's another bad thing about increased aging, is people tend to be iron overloaded in Western societies. But I thought this was interesting that there's independent supportive data for that, the Kell and pretorius theory of amyloid-like clotting of fibrinogen due to dormant bacteria and their endotoxins. That's kind of a cool thing. And most doctors don't know that. I mean, infectious disease specialists don't know that. I have some friends that are infectious disease doctors, and I talk about all these things, and I kind of tease them. Because most doctors don't read much. You'd laugh, but most doctors are kind of functional illiterates. They don't read much. So they almost give you this look like, oh, why are you telling me something new? Then I have to go look it up and read. I don't feel like reading. I'm tired. I'm busy. Anyways, red blood cells, like I said, they're about 7 microns, capillary about 5 microns in diameter. If you stick them all together due to reload formation, like with high LDL cholesterol, make them into like a big sandwich, then it's harder to push them through this capillary here. Normally the red blood cells, they've got what's called a Zeta potential. And the Zeta potential means that they have negative charge on their outer surface, for example, from the sialic acids, from the cholesterol sulfates. But either way, they repel each other. And the arterial wall has Zeta potential. The white blood cells have Zeta potentials. Everything's repelling each other, so it doesn't stick together. That's good. That's what you want. But when you get increased amount of bridging molecules, things like LDL cholesterol, IgM antibodies with an acute infection, fibrinogen, like from the acute stress response, it's an acute phase reactant protein, meaning it's released from the liver in the context of stress or injury. So that'll go up. And also uric acid will do it. Excessive ingestion, for example, of meats or excessive ingestion of high fructose corn syrup can cause that to go up. The higher the LDL cholesterol, the thicker the blood, the higher the blood viscosity. That's why cholesterol is such a big risk factor for atherosclerosis, because it sticks red blood cells together, and atherosclerosis is red blood cells sticking together, a clot. Okay, what I'm going to do is I'm basically showing you a little bit more about atherosclerosis and stuff, so that I'm going to, after all these pictures, I'm going to go into discussing some of the finer points of dementia prevention and the vascular hypothesis of dementia from Torre. So this is just background information. Normally blood flow is like a parabolic right here, meaning that in the middle it goes fastest. That's the red blood cells. And then outside those are the white blood cells. And then in the periphery is the plasma, right again, adjacent to the endothelial cells or the glycocalyxes. All right, that's normally how it flows. But when it's all stuck together, it can't flow as smooth, plus pressure has to go up. And when you get to a bifurcation, we'll see that I think on the next slide here. When you get to a bifurcation, this high pressure hypertensive blood hits the median divider. Here's ECA, external carotid artery, ICA, internal carotid artery. It hits the median divider and it bounces off and it's turbulent. And some of it will go retrograde. Those are called retrograde eddy currents. And the point I'm making is abnormally high pressure leading to an abnormal increased amount of turbulence and retrograde flow is sensed as injury by the endothelium, the lining cells here on the internal carotid artery. And when that happens, they shed their glycocalyx and all their antithrombotic chemicals and make less nitric oxide, for example. They shed their heparan sulfates and whatnot. And instead, you get a clot forming. The red cells start adhering and the platelets become activated. They adhere to the wall, and you'll always form it right here. That's where I see everyday atherosclerosis developing, an early site. Okay, and then pieces of this can break off and go up to the brain and cause a stroke. Okay, here's just showing an endothelial cell. Normally they're making, the main thing we need to know for our purposes, they make a lot of nitric oxide. That's really all we care about for our purposes. There's always more we can talk about. Endothelial glycocalyx has antithrombin 3 and heparan sulfates, also working to prevent clotting. Nitric oxide goes out into the blood, prevents the platelets from clotting. It goes also backward into the arterial wall, causes the smooth muscle cells to relax, so the wall dilates. Okay, vasodilation. We talked previously about the need for eating a high potassium, low sodium diet to maintain proper neuron plasma membrane gradients, typically about negative 65 millivolts. If you eat, because our ancestors ate about 25 times as much potassium as sodium. If you eat way too much sodium, a modern person will be eating, let's say, 10 or more to 1, 10 times more sodium than potassium. You will then tend to mess up these electrochemical gradients, and the net result is the cell will be less able to effectively pump out the calcium, because the sodium electrochemical gradient, electro for the negative 65 millivolt charge, chemical for the concentration difference, usually got about 140 sodium outside, 14 sodium inside, relatively speaking, so a tenfold gradient. That's used, that gradient is coupled by allowing sodium to come into the cell simultaneously. You can then pump out calcium, and if you can't pump out the calcium adequately because you dissipated these gradients from excessive high dietary sodium, this calcium won't be pumped out. It'll accumulate inside the cell, and it causes increased metabolic activity of the cell, and that can lead to increased metabolic demand and increased risk that neuron will be damaged and go into apoptosis because its energy needs aren't being met. Super important for a neuron. A neuron uses about 2/3 of its energy, all its energy, to run this pump, this potassium sodium ATPase pump, because it's how it makes a battery on its plasma membrane. Okay, here's a typical neuron. Here's a cell body where the nucleus is with the DNA, some mitochondria up here. Here's the axon. An electronic nerve impulse is transmitted down from up here's the axon hillock, and it's transferred all the way down to the synaptic terminal, axon terminal. When it reaches this level, calcium comes into the cell, and that causes the neurotransmitter vesicles to travel to the synaptic junction, merge with this plasma membrane, release their neurotransmitter. The neurotransmitter goes across the cleft of the postsynaptic neuron, exerts an effect on the postsynaptic neuron. Okay, that's how neurons work in the brain. Oh, another thing too, we briefly talked about the blood-brain barrier here. And with the blood-brain barrier, you normally have glucose 1 transporters that just let glucose come across, relative to its concentration there. And then everybody knows, in all the books they'll tell you, well, there's glucose type 3 transporters for glucose on the plasma membrane of a neuron. These are neurons over here. This is an astrocyte, more star-shaped, if you will, with these, stellate projections. This is a neuron, okay? And the relevance is, that's what all the books say, but the books are wrong. There's also glucose type 4 transporters in your neurons, like including in your hippocampus, and these are insulin sensitive. So what I'm saying is when you've got diabetes with insulin resistance, you've also got insulin resistance in your brain, limiting the amount of glucose that can get into these neurons, okay? But still, this picture gives you a good idea. These are the astrocyte feet plates along the blood-brain barrier. So if you damage this blood-brain barrier, that means all kinds of stuff from the blood gets into the brain parenchyma that's not supposed to get there. Your blood-brain barrier is kind of like a bodyguard that prevents toxic things from getting access to your brain. You got one around your testicles and around your ovaries as well. They're important things in your body that are unique and have to be protected. As well as to function correctly, you have to have precise ion concentrations outside your neurons. And if you're letting stuff come in from the blood that's not supposed to get into the brain parenchyma, the brain tissue, parenchyma just means brain tissue, then you're going to potentially throw off your neurons, their conduction, their ability to conduct an action potential. And that's going to give you things like brain fog and ability to concentrate, which a lot of people have. I got young people telling me they got brain fog, young doctors, okay? My concentration is still great, and it was much better when I was young. I'm 60 years old, okay? Okay, some key points now. We're going to get into some finer points, okay? The atherosclerosis risk factors are the same as Alzheimer's. Whenever two diseases have the same risk factors, quite often what that means is they're the same disease. And that's kind of the point Delatorre's making. He's like, this so-called, mysterious beta amyloid being the key mechanism of Alzheimer's is bogus. We'll talk about that for multiple reasons. The vascular issue is much more common. That's why they shouldn't even call it Alzheimer's. They should just call it dementia. Or even really you could consider calling it vascular dementia, but there's a little more to it than that. Okay, beta amyloid plaques. BAP is for beta amyloid plaques. And by the way, this JT stuff is for Jack Delatorre, and that's the page number in his book, Alzheimer's Turning Point. There's your page number, okay? So that way, if anybody wanted to, you could read the book and you can correlate it with my lecture if you wanted to. The beta amyloid plaques, senile plaques, same thing. They don't correlate well with neuron loss or cognitive impairment. That's another reason why. Basically, what Delatorre is saying is this whole built-up idea of amyloid and Alzheimer's being so common and so relevant, he says, is bogus. Okay, we talked about this before. There's no historical finding, no physical exam finding, no good, reliable laboratory finding, no good, reliable, common imaging finding, and even at autopsy, you can't really tell because normal people also have senile plaques and neurofibrillary tangles. And so you don't necessarily know. So if you can't diagnose it, in any way effectively, and you can't treat it effectively, isn't it? Does it exist? Is that not potentially largely BS? Okay, Delatorre says you can have lots of beta amyloid protein in your brain and still be cognitively normal. He says the PIB PET scan for diagnosing Alzheimer's disease, in his opinion, is a waste of time. Both BAP, beta amyloid protein, SPs, senile plaques, and neurofibrillary tangles are seen in cognitively normal people, a very significant number of them. Also in patients with traumatic brain injury, and patients with Down syndrome, and patients with Parkinson's disease. So it's not pathognomonic. It's not specific for Alzheimer's. So that's an important point. And it's a little bit of a chicken and the egg problem, which came first. And we now know that the lack of blood supply comes first, and it's much more relevant. Let's see. Yeah, he says lots of people without dementia have a lot of senile plaques, beta amyloid. Even at post-mortem autopsy, you can't reliably distinguish them, okay? As a person ages, cerebral blood flow decreases. We talked about that. Brain hypoperfusion induces A beta amyloid protein in cortical neurons, so you make more of the beta amyloid, the bad type. But ischemia comes first. Important point. Hippocampal neurons in our memory centers are the first spots to die with chronic reduced blood flow. We covered that. He also raises the point, can you get mood swings, anxiety, depression due to a lack of cerebral blood flow? And it probably contributes to it, as do all these other things, these stimulants and these vasoconstrictors and these mitochondrial inhibitors. Okay, we know that metals tend to be toxic to the brain, and there's a whole bunch of them here. And the most common one you hear about is aluminum, but also mercury, cadmium, copper, excessive amounts of copper and iron, lead, arsenic. They're all toxic to the brain. Delatorre claims that you still have the same amounts of Alzheimer's disease, even in areas where aluminum is not that common, aluminum exposure. Some people would disagree with that. He also says you don't get that much aluminum accumulation in the brain. But there's another guy, real famous aluminum researcher, actually, he disagrees with that. Okay, aluminum itself doesn't cause the brain senile plaques or neurofibrillary tangles, according to Della Torre. And you got to remember, Della Torre is a little bit biased. He's trying to prove his theory, okay? So he wants to refute everything else. Do I think Della Torre is right? Yes, I do. I think Della Torre's theory and my theory, which I talked about in my previous lecture, my newsletter lecture, are the two best ones. The other ones are all relevant, but, you know, his and mine, they both tell you exactly what you need to do, what to avoid, okay? Decreased mitochondrial ATP production will cause more senile plaques, neurofibrillary tangles, memory loss, and cognitive defects. And that's a little bit why I went through that recent lecture on all this calcium signaling, because I'm making the point, if you don't get your calcium signaling correct, because you're eating too much dietary sodium, for example, and not enough plant foods, potassium and magnesium, you mess everything up. You damage your mitochondria, you increase the risk your neurons are going to go to apoptosis, because high cytoplasmic calcium is an excitotoxic effect, and you get the same problem if you have SERCA inhibitors, sarcoplasmic endoplasmic reticulum inhibitors, and you also get equivalent problem if you can't make ATP because your mitochondria is inhibited by all those chemicals. So I recently gave that lecture, if you're interested, calcium signaling lectures, as well as a book review on that calcium connection book, that all of those things go towards the same problem of an excitotoxin effect, and they all damage your neurons, so you want to avoid them. We talked about getting your hypertension under control. The sooner the better, so you'll have more intact fibers remaining in your ascending thoracic aorta. With increased aging, as a tendency to stiffen, I tell you, I see it on tons and tons of old guys. I expect their thoracic aorta to be calcified and stiff. That means loss of its elastic fibers. That means they're all hypertensive. We talked about high blood pressure, especially when it gets over 160, has a tendency to damage arterial walls, and then they'll react with fibrosis, so they're going to be less able to deliver oxygen to your brain cells because they're thickened from the scarring. The fibrosis means scar tissue, also especially collagen. Hypertension, this is Della Torre talking. Hypertension is the most important risk factor for Alzheimer's disease. That's an important point, because a lot of people think hypertension is kind of like a joke because it's asymptomatic typically, but no, it's a big deal. And what do you want to do to fix it? Avoid excessive dietary fat and avoid excessive dietary sodium, okay? And avoid excessive stress in your life. Manage your stress. Eat your plant foods. Get your potassium and your magnesium and eat them low fat. Those make a big, big difference in blood pressure control. Okay, a couple more subtle points from Della Torre's work. Young rats didn't get it because they had more reserve to maintain blood flow. Middle-aged and older rats demented in 2 months. At autopsy, no stroke. Okay, here's a nice quote from Della Torre. We saw no evidence that brain hypoperfusion caused strokes or ischemic lesions in the white matter, which could have indicated vascular dementia. So what he's saying, on the same side he tied out the carotid, there was no stroke. There wasn't even an ischemic lesion like a flare hyperintensity or a silent stroke, so to speak. There simply was an atrophic brain. Okay. Older rats are more vulnerable. And then he says basically, so-called Alzheimer's disease is really a vascular disease. Yeah, good. That's an important point, primarily. Okay. And he also talked about something he called a threshold effect, a catch, critically attained threshold of cerebral hypoperfusion, meaning that if you just have like a widened gap, like let's say to this difference between metabolic activity in neuron and oxygen and glucose delivery, you might not have any damage whatsoever. But if you just go a little farther and make it like this wide between what the neuron needs and what it's actually getting, the neurons start dying. So to me, that's kind of like incrementalism theory, the idea that you try to do every little thing correctly because those little things all add up, and you don't know how many things you need to do. Let's say there's 12 things you could do to improve blood flow. In my opinion, I would try to do all 12 if that were possible, just because it might be that if you only do 5 of them, you don't get as much benefit as you want. But as soon as you do 7 or 8 of them, all of a sudden you get a lot of benefit. You tip past a threshold point. And there's a lot of things like that in the human body, okay? So that's why I think the smart move is always do the best you can. And then you get the best result you're capable of getting. Oh, and Jack Della Torre, how confident is he that he's got the correct explanation of so-called Alzheimer's dementia? He says, I've never been as certain of anything else in my life. And I can tell you, his work's real impressive. It totally fits everything I've seen and everything I know about it, so I think he's right. Okay, any other interesting points here? The beta amyloid cascade hypothesis. When you learn about these things, they don't really tell you what to do. I just told you what to do. Avoid everything that prevents leaky gut. And I think that's about as well off as you're going to be. Avoid ingesting extra iron. Avoid all those iron fortified foods. Avoid, all your meats, especially your red meat. You want to avoid the iron. Okay. I can tell you almost all the, 95% of the patients I see with dementia are diabetic or hypertensive or both. All these disease theories are a big deal because once you understand the mechanism of what's causing the disease, you avoid that thing. There's a lot of things you do. You can avoid exposure to aluminum. You can avoid exposure to saturated fat, oils, MSG, MFG, estrogenic chemicals, aluminum and lead. You can exercise more, sweat out your toxins, improve immune function. You can get adequate sleep. You can read and study to build up your cognitive reserve. There's a lot of things you can do. Okay, this is just sort of a repeat of some of the things we talked about. Familial Alzheimer's is really small in frequency, only about 3%, maybe 4% at the most. And they talk about some of the important genes being located on chromosome 21, such that Down syndrome patients have an increased risk of Alzheimer's, so-called Alzheimer's type dementia. This is just a little bit about familial Alzheimer's. We're not going to get into that, though. Chronic cerebral hypoperfusion. We talked about all this. And that's why I say you want to become low-fat, low-sodium vegan, or you're kind of screwed. If you're, a fat person and you got sleep apnea, that'll also drop your oxygen delivery to your brain cells, increase the risk. They're going to go into programmed cell death, apoptosis. This is just sort of, let's see what I got here. I was just sort of saying, well, we kind of talked about this before. The books are all wrong on everything. They're all wrong on Alzheimer's. They don't even mention Torre, the best researcher in the history of Alzheimer's research. And he put his theory forth, the vascular hypothesis, back in 1993. It's still not in the current textbooks. They're never going to talk about something that they're not positive they can definitely make money from. And a lot of places, too, he comes from, like, Texas or something. A lot of places, too, like, let's say an Ivy League school, they won't publish stuff if it doesn't come from them or from the Ivy League. It's true. But that's why their books suck. And that's why most neurologists don't know this. I have neurology friends, and I teach them this stuff, okay? And they're all like, wow, that's good, that's right, that makes sense. Because it's not in any of their books. Let's see. By the way, I've never in my whole life met a single doctor that's familiar with Torre's work. Not one. The only ones that know about it are the ones I've taught them. Okay, so we come to our last slide. I hope that was helpful for you. It's pretty interesting, and it shows you what to do. You basically avoid the things that cause hypertension, which especially is eating a high-fat diet and high-sodium diet, and you make sure you eat your plants so you get your potassium and your magnesium, and that should optimize your blood pressure as much as you can, and your body weight will move to optimal, and that'll improve your blood pressure too. So anyways, hope that was helpful.